Good afternoon. I'm Jonathan Stone, the Marketing and Communications Manager at Downtown Cleveland Alliance, and I'd like to thank you for joining DCA for the 32nd episode of the Downtown Now webinar series. After the panel discussion, we'll have a Q&A session. Throughout the webinar, you are welcome to submit your questions using the Q&A button on the menu bar. This way, we'll have questions queued up and ready to go to start the Q&A. Also, feel free to utilize the chat box, and we'll do our best to address your comments throughout the broadcast. I will now turn it over to our Executive Vice President for Business Development, Michael Deemer.
Thank you, Jonathan, and thanks to all of you for joining us for another episode of the Downtown Now webinar. Well, we've been waiting for over a year for a vaccine to bring us some relief from the pandemic. And there were times over the last year where it felt like it might never come, even as doctors and scientists around the world were working feverishly to develop vaccines at record pace. And here we are, in many ways, the moment that a lot of us have been waiting for, when there is light at the end of the tunnel, a return to normalcy that we can see on the horizon. And it's largely thanks to a vaccine that's becoming rapidly, widely available. And we're especially fortunate here in downtown Cleveland to have the largest mass vaccination site in the state of Ohio at the Wolstein Center at Cleveland State University's campus. And we're going to talk a lot about that today. And we're joined really by the perfect guest to do that. Our guest today is Dr. Forrest Faison, the Senior Vice President for Research and Innovation Chief for Health Strategy at Cleveland State University. He currently leads the university's support for vaccination distribution at the Wolstein Center. He also has a storied career in the military, having served for nearly 40 years and rose to the rank of Vice Admiral. And in that position as chief of the Bureau of Medicine and Surgery, he oversaw a global network of over 63,000 medical professionals. In addition to his service locally and to our country, Dr. Faison is also a proud Cleveland boomeranger, and we love our boomerangers in Cleveland. He grew up in Rocky River, spent a life serving our country, and now has returned home to Cleveland. So we want to welcome you back, Dr. Faison, and thank you for being our guest today.
Thank you, Michael. Thank you so much. It's a privilege and honor both to be back home and to be here with you today. It makes me proud every day to be a Clevelander and to be an Ohioan. So thank you very much.
Well, we have a lot to talk about, but I thought what we would begin with is really the topic that's on all of our minds, that's so important to the public health of our community, our country, and the world, and that's the availability of the vaccines. And I wondered if you could just begin by talking a little bit with us about the importance of people getting the vaccine and the safety of getting the vaccine.
Absolutely, Michael. Thank you. Well, you know, if you don't remember anything else I say today, please remember these three words: get the vaccine. It's safe, it's effective, and it is your best protection against getting sick, hospitalized, or having a bad outcome from COVID. All three of them are good. All three are effective and safe. And so no one is better than the other. I got the vaccine, my family got the vaccine, and it's just a good thing to do. And it's it's a good gift that you can give not only yourself, but your family, to make sure that you're going to be around for them. And so I encourage everyone to get the vaccine. There's a lot of concern about why was it fast tracked and did we cut corners? And the answer is no. From my past career, I have many friends and colleagues that work at the FDA and CDC. And in a normal process of approving a vaccine, there is a lot of bureaucratic time lag built into those processes. That's just to make sure that, the bureaucracy can catch up with the testing. In the case of these vaccines, all of that bureaucratic timeline was removed, but nothing regarding the testing, efficacy, or safety evaluation of those vaccines was changed or moved or shortened. They are safe, They are good, they are effective, and I encourage everyone to get vaccinated.
Well, I thank you for that very important public service announcement regarding the importance of the vaccine, which, it's a message that we share as aggressively as possible here at Downtown Cleveland Alliance. And we're fortunate, as I said in the introduction, to have the largest mass vaccination site in the state. It's widely and readily available. Can you tell us a little bit about the operation at the Wolstein Center and how folks can go about making an appointment and getting themselves vaccinated?
Yeah, absolutely. So, as you know, the White House identified the need for increasing the rate of vaccination across the country and identified several locations for a mass vaccination center. And Ohio was one of those. And so the governor came together with his advisors and talked to people in the different communities on where should this be placed. And they decided on Cleveland. And they chose Wolstein and Cleveland State University. We were honored to host this because there was a potential to help a lot of people. Within a mile of Cleveland State University, 45% of the people live below the poverty line. And within a 6-mile radius, there are over 100 communities that are classified as socially vulnerable. And these communities have been hit very hard by the pandemic. This was an opportunity to set up a mass vaccination center to be able to reach out to them, get them in, get them vaccinated, get them protected, and at the same time, bring in others from the community to get vaccinated. You go to the website that the state has stood up, gettheshot.coronavirus.ohio.gov, and you can make an appointment there. They have planned for over 6,000 vaccinations a day, and they're doing a great job with this. This is a state-run effort under the command of a task force. Brigadier General Becky O'Connor is an Ohioan that's in charge of the overall operation, and they are doing amazing work every day. So there really is no reason to not get vaccinated. There are, in addition, dozens and dozens of vaccination sites throughout both the city, the county, and then the surrounding counties. It has never been easier to get a vaccination than it is today.
Well, and I've got to say, all the feedback that we've gotten from everybody across downtown that has gone to the Wolstein Center has been terrific. Just the interactions with all of the staff there that are facilitating the process, the time, the smoothness of it all. All the feedback has just been really terrific. One of the things I wanted to ask you about as well, in terms of the effectiveness, importance, safety of the vaccines. There are 3 main vaccines out there. Is there any difference between the 3, and should people prioritize one or the other, or try to get one or the other?
No, thanks, Michael. They are different vaccines, but what I tell people is whatever one you can get, take it, because they're all effective. To benchmark this for you, when you get your annual flu shot, that is, on good years, about 50 to 60% effective in identifying and targeting the right flu virus. These vaccines are 70, 80, and 90% effective. Much more effective than the annual flu vaccine. They're all effective in keeping you healthy and protecting you. So whatever one you're offered, take it. There are differences. The Pfizer and the Moderna vaccine require a 2-shot regimen. The Johnson & Johnson vaccine is a 1-shot regimen, but both are effective for that. Both will give you a little bit of side effects, with a little bit of achiness and things like that. But what I tell people, that's actually good, because that means your immune system's working. That means your immune system is ramping up so that if you do get the virus inside, it'll get defeated before it can make you sick.
Well, I want to circle back and talk a little bit about some of the lessons learned from the experience of the pandemic and the Wolstein Center distribution program. But when we were talking a few minutes ago before the program started, we were talking a little bit about the governor's directive to colleges and universities around the state to vaccinate college students before they head home for the summer. And I know that's something you've been working on at Cleveland State and have some breaking news about. So if you could tell us a little bit about putting that process together as well.
Absolutely. So the governor has really been leaning forward to get people vaccinated. And he has seen, just like the rest of us have, there are now emerging variants of the virus. There are, increasing cases in many states, including Ohio. And if you look at that, college age students are at increased risk. They are now comprising a larger percentage of those folks that are getting infected. And they're all going to go home soon for summer break. And so to his very great credit, he said, let's try and get as many of these students vaccinated before they leave for the summer as we can, to protect them and to protect their families to whom they'll be going home. And so we stood up a vaccination center for CSU students here on the campus. It opened actually today, and that's actually where I'm speaking to you from. We're providing the Johnson & Johnson, kind of one and done is what we call it for our students. And our students can go in and register, can make an appointment. The way it's set up and the way the governor has asked us to do that is to focus only on vaccinating college students. So you have to be a CSU student to get vaccinated at our center. But if you're not, there's plenty of other places to get vaccinated. And then they come in and it's operated just like the Wolstein Center across the street. So our students come in, they get checked in. It's about 20 minutes from the time they walk in until they leave. And today on our first day of operations, we've seen over 200 students. And the appointing site's been up for less than 24 hours. So our students want to get vaccinated. They want to get back to their normal lives. They want to get back to their studies on campus. And they're taking it seriously. And so we're going to be there to help them. We have appointments for well over 10,000 students between now and the end of the semester. And we're going to get as many as we can in and get them vaccinated so they go home protected to their families and so they can get on with their lives and with their studies.
We've talked a couple of times now about the governor, the role of state government in facilitating the vaccination distribution process. And, every state is doing a little bit differently. If you had to give Ohio a grade on how we've approached this, what grade would you give Ohio?
I would give Ohio an A+++. Ohio has done some things that we're just not seeing in other states. They leaned into this very heavily. They set up vaccination sites. They were very aggressive in testing and things like that, and really have leaned into protecting people, putting in place those things necessary to keep people healthy and prevent them from getting infected. And now, again, spreading and making available vaccination to as many people as they can. I've really been impressed with the great job that the state has done. And it's been, what I would call in the military, an all hands on deck, from the governor to his staff to the, Ohio Department of Health, the Emergency Management Agency, and countless others, the local county and city public health departments. This has been a collaborative effort that has really paid off. Within higher education, as an example, and we can talk about this when we talk about what CSU's done, but all the public universities came together when this thing first broke last March and said, hey, listen, if you're a student or a parent of a student that goes to college in Ohio, you ought to have some comfort that the approach to protect your son or daughter is the same throughout the state and represents best practice. And so all the universities came together in Ohio to coordinate how we prepared people and took care of them and protected them on the campuses. And Cleveland State was privileged to lead that effort. And I've been just so impressed with the state and how they've taken care of their citizens.
Well, why don't we talk a little bit about how the colleges and universities approached things over the last year? It was obviously a challenge. It was towards the end of the academic year when this all started. There were spring breaks to deal with, summer break to deal with, returning to classes in the fall and figuring out what to do with all of that. How did Cleveland State approach making sure that it was keeping its students and faculty safe?
Absolutely. Well, when this first broke, The president called us all in and said, we really want to make sure we're taking care of students and we're protecting both our faculty, staff, and our students, because our students sacrifice to go to college. As you and I were talking about, many of our students hold down jobs because they're the breadwinners for their families in addition to going to college. Many of them are first generation. We run a food pantry for our students that are challenged to be able to take care of their families just so they can get through, because 80% of our students stay in Cleveland after they graduate. They are Cleveland's future. And the president realized that and said, let's do this right. And so we rapidly pulled together a team of experts that I was privileged to lead in IT, from the faculty, with great faculty support from all the different areas of the university. And in about a week, took 1,200 courses and converted them all online. And over the next few weeks and months, as we coordinated with the other universities, really put in place what we called the 7 layers of protection on campus. So it was mask wearing, it was hand washing, physical distancing. Those classes that we could do remotely, we did remotely. Those people that could work remotely, we allowed them to work remotely. We focused on our research labs to make them safe, and our faculty led the way on this and just did an amazing job in putting in place protocols to keep people safe and keep people healthy. And all of these things we've continued to build on. We hired student ambassadors to walk the campus, and I got reports from them every day about how many people were wearing their mask, how many people did you have to remind? And it was virtually 100% of people were wearing their masks because people took it seriously. And it paid off because Cleveland State was among urban universities in the United States. Cleveland State had the lowest positivity rate, and we had no outbreaks to date. I'm knocking on wood here, but we've had no outbreaks and the lowest positivity rate of any urban university in the United States, just because the people took it seriously and they did a great job.
Well, that's great to hear, and a great testament to your leadership and President Sands' leadership, but the compliance of the students as well. That's really, really great to hear.
And I also want to give a shout out to the faculty. I mean, the faculty just did an amazing job. When they've never really had to do remote learning before, to take courses in over a 7 to 10 day period, take 1,200 courses and convert them online so that we didn't miss a beat for our students who were sacrificing to get their degrees and get on with their future. They just did an amazing job.
I want to ask a little bit about, we've talked about the racial inequity in the city, in the area immediately surrounding the Wolstein Center, high concentrations of poverty. We also talked the other day a little bit about how, the pandemic really, shined a spotlight on those inequities. And, I wonder, again, as we're distributing the vaccine, starting to, think about public health in different ways, how we provide medical care to underserved populations. I wonder what sorts of early lessons you're deriving from, how we approach medicine and how we can more effectively address some of the racial inequities and the concentration of poverty and all the related issues that come with that.
Absolutely. We have learned a great deal from this pandemic. And we've had pandemics since antiquity. And this won't be the last pandemic. So we'll have a window of opportunity to address those things. Cleveland is such an amazing city, and it's an interesting city because despite having some of the best healthcare in the world at the clinic, at University Hospital, at Metro Health, and the countless other providers that are in the city, arguably the best healthcare in the world, the health of Cleveland has got challenges right now. And we've learned about that. We've learned that on many measures of health, Cleveland residents are below national norms. That there are food deserts. It's hard to control your diabetes when your only food option is McDonald's, as an example. It's challenging when you don't have transportation. We have challenges with connectedness. And there are, well over 150 philanthropic organizations in the city because Clevelanders are so warm-hearted and they want to help trying to address these things. But you have to look at, hey, this has disproportionately impacted the urban environment and the urban populations. And we saw that with greater incidences of hospitalizations, with deaths and things like that. It was things that we knew there really are disparities in healthcare and disparities in health access that we need to get after. There really are challenges in the urban environment that we really need to get after to not only protect the health of Clevelanders in preparation for the next time, but really to raise the health of the city. There are economic impacts if we don't do that. Healthy economies are built on healthy communities, and we want to attract industry and innovators to Cleveland. But we're competing with other cities. There's no, it's no secret that some of the top technology and tech innovative destinations in the world, in the nation, are also the top healthiest cities in the nation. In Cleveland ranks 157th. So we've got opportunity here for that. It's one of the things that we're working on at Cleveland State right now, because as we look ahead of how do we need to prepare for the future for our graduates to have the careers and skills that they're going to need because they are Cleveland's future, and then for the community that we serve. And one of the areas that we're focusing on is urban public health. We're in the process of let's establish an institute to bring together medical and non-medical, urban planners, urban policy, engineers to look at environmental management, and then our health colleagues in a partnership with the clinic, with UH, with Metro, with CASE, with all of these philanthropic organizations, and let's bring them together and crack the code and solve the challenges that we saw in this pandemic. And oh, by the way, set the stage and put us on a trajectory to be that healthy community that is going to be attractive to industry to relocate here and attractive to innovators that want to come here and continue that economic revitalization. You cannot do this unless you've got healthy communities. Healthy economies are built on healthy communities. So we're focused on that. It's a priority.
And I think, if I'm not mistaken, much of what you just described is encompassed in the Cleveland Innovation District that the governor and all the partners that you just mentioned, including Cleveland State, were part of announcing earlier this year. $500 million investment in creating the type of infrastructure in Cleveland that you're talking about. And I think you captured a lot of it, but I wonder if you could elaborate a little bit on that announcement, the goals of that innovation district, both in terms of addressing the inequities that we've discussed and the opportunities to start and develop and spin off new businesses and attract new talent and develop new talent in our city and region.
Absolutely. So this is really quite a historic agreement because it was 5 partners in the community. So it was Cleveland State, Cleveland Clinic, University Hospital, Metro Health, and Case Western came together and said, how might we partner together and look at both how do we prepare for the pandemic of the future, raise the health of Cleveland, and better serve our community. And we put together a partnership with this, and each of us bring different things to the table. So Cleveland State, as an example, we bring the talent because so many of our graduates stay in the area after they graduate. And so we'll be privileged to build and grow the degree and certificate programs that our community is going to need as Cleveland Clinic, UH, Metro, and others build out efforts in virology research, in connected health, in a variety of different areas that are going to benefit our community. We'll be able to provide the talent pool to be able to support those efforts in the future. And then our certificate programs, we'll be able to take our existing workforce and upskill them for the future. As technology continues to evolve, we have to continually educate, train, and increase the abilities of our existing workforce. And so our certificate programs will allow us to do that in a way that will be supportive of their life, supportive of their jobs, but will fit within their life, but allow them to get the knowledge, skills, and things they're going to need to be the workforce of the future. And then, as you know, Cleveland was hit pretty hard by the pandemic, with people losing their jobs. And this is an opportunity to reskill and retool and learn new skills. And those programs will allow us to do this. So we're in partnership with not only our community partners with the Jobs Ohio, but we're talking to community colleges about, hey, how do we take some of these high school folks that are going to our community colleges and then create pipelines for them to a 4-year degree. And then we've got community outreach that Cleveland State has actually been doing for quite a while that we're building out, because it doesn't start when you start college. You got to be ready for college. And a lot of our students in the community don't have that strong STEM foundation in science and technology and mathematics. So it's summer camps. It's reaching out to them and helping prepare them for college. So it really becomes a pipeline from K through 12 all the way through college, community colleges, and then 4-year degrees, ultimately resulting in a workforce that is ready and prepared to meet the needs of our innovators, our industry, and our business leaders, not only today, but well into the future.
Well, it's a terrific opportunity for Cleveland. You're absolutely right. The level of collaboration that is formed around the Innovation District, the level of investment that's taking place. It's something that I know at Downtown Cleveland Alliance, we're very excited about working with Cleveland State and all the partners on maximizing the opportunity to, heal the inequities that we've talked about and bring as much talent and business growth into the city as we can. I'd like to shift gears for a minute. I know oftentimes people who have committed their lives to public service do not like to talk about themselves, but I'm going to ask you to talk about yourself for a little bit now. You bring such an interesting and storied background back to Cleveland with you. I mentioned in the introduction, you served nearly 40 years in the Navy. You rose to the level of Vice Admiral. I think I left out that you were the Surgeon General of the Navy. I mean, tell us a little bit about your career before coming back to Cleveland, and maybe tie all of that experience and how that's helped you over the last year in managing the pandemic and the vaccination process in particular.
Oh, thanks, Michael. Well, I tell people sometimes God plans your life differently than you do. When I was growing up in Rocky River, I learned, and my parents taught me that life is about helping people. The impact that you have is the impact that you have for others. And so that was the reason I went into medicine. And, I chose medicine as a career because I thought it was a great way to help people. I couldn't afford to go to medical school. And so the military has a medical school. I really couldn't afford to go to college. And so I put myself through college by being a lab assistant at that medical school, kind of cleaning test tubes and things like that. And I learned about medicine, and I realized that was a good way and a good career to help people. And since I couldn't afford to go, I applied to that medical school because it was it's a service academy, but for medicine. So it's like Annapolis, but it's for medicine. And I got in and I was accepted. I chose the Navy because I thought you'd always be near a beach. Truly. I had no military, heritage at all. And I ended up going into pediatrics because I was attracted to that, and ultimately specialized in neurodevelopmental pediatrics, which is the care of children with developmental disabilities. And you don't really cure autism or cerebral palsy or things like that, but you help families go through a grieving process of the normal child that they're not going to have, and then realize that there is joy and hope and a wonderful life ahead for the child that they do have. And then you help them deal with those things. I just found that rewarding. Well, the longer you stay in the Navy, the more senior you get. And I had an opportunity to go and do some different things, and ultimately led me into leadership positions within the Navy. And I've been blessed to live all over the world, and really have been blessed to be involved in just some amazing things with some just incredible people. Less than 1% of our nation serves in uniform today. And everyone that you see in uniform volunteered to serve, and I was privileged to serve with them. And some of the things that I was privileged to lead was the medical response to the earthquake that happened in Haiti. When that earthquake happened, that earthquake destroyed every hospital in that country. They had nothing. And so we got the call about, can we send one of the hospital ships down there? And I was the lead for this. And so in a period of about a day, that hospital ship was in dry dock with a big hole in the side because we were replacing equipment. And normally that hospital ship would go down to Miami for 5 days, take on staff, take on provisions, and then go down to Port-au-Prince. But we put the call out and say, hey, you patch the hole, you get the people, you get the supplies. And that ship left Baltimore 48 hours later, fully patched up, went directly to Port-au-Prince to get there 5 days early to start saving lives. And I was privileged to help lead that. I was privileged to lead the medical response to the Fukushima earthquake. Not only the support that we provided to our friends and partners in Japan to help them with that, but we evacuated 8,000 to 10,000 American citizens over a 48-hour period back to the United States with medical support along the way, and I was privileged to lead that. I was privileged to lead the Navy provided all the laboratory support for the Ebola outbreak in Western Africa when that happened a few years ago, and I was privileged to lead that. And ultimately, we created a lab there that is in the process of developing a vaccine for Ebola, and that's a Navy operation that we put in place. And then what most people know, when Zika happened, the Navy did all the testing for the southern United States, and I was privileged to lead that. And then ultimately, we started a lab in Western Africa because that's where Zika came from. To learn about how we might create a vaccine there. And then in between all of that, I was privileged to command a combat hospital in theater. And so I've just had, an amazing life, and just blessed to work with and have the privilege of leading just some incredible people that help around the world. Navy runs a global health system, as you said. We take care of, 128 hospitals and medical centers, taking care of about 3 million people, 67,000 folks. And we are the one of only 2 countries that maintain a standing medical force to get out the door tonight. Because our nation expects, if we go to war tonight, our nation expects our military to protect our freedoms tonight. It means you have to be prepared to save lives tonight. And so we've got one of the top medical systems in the country that I was privileged to lead. And so it's just been an amazing journey. And when I finished that, I looked around and said, okay, what can I do next? Well, again, life's about helping people. And I realized that I could come back home, and I talked to President Sands, who really approached me and said, hey, would you be interested in coming back and helping us build health education programs to get more underserved, disadvantaged minority students into careers in healthcare? Absolutely. Would you be interested in coming back and help deal with some of these public health challenges in Cleveland? Absolutely. So that's what drew me back, because it's an opportunity to help people. And so it's great to be back home again.
Well, I know you were very generously heaped a lot of praise, and rightly so, on our state government's leadership. But I've got to say, we were very lucky here in Cleveland to have somebody of your background in the right place at the right time. So thank you. Before we pivot to some questions from the audience, I wanted to ask you about your boomerang experience and status. I wonder if you could talk a little bit about the city that you left many years ago, and your impressions of the city, the downtown specifically, since we're downtown Cleveland Alliance, that you returned to, and you've traveled the world, you lived abroad. What were your impressions of your hometown, having experienced all of that and returning?
Yeah, absolutely. So I left Cleveland in 1976 after I graduated high school to go to college. And at that time, It's a very different city that I left than now. You know, I remember the Cuyahoga River catching fire. You know, I remember some of the challenges of the city, and I came back to a city that is just amazingly beautiful, wonderful, with just incredible people. The revitalization, the growth that has occurred, really the Midwest, let's take care of our neighbors, you know, attitude has really just been amazing. And it's just a real privilege to be back here and to deal with folks. You know, the pandemic, being involved with the city and the mayor's staff and you know, the county and you know, the county executive and public health, and really working through some of these things has just been gratifying to see. You know, the can-do spirit that's here. You know, one of the things that I didn't talk about was, you know, what did I learn from all of these experiences around that I had the privilege to be involved in? It's the importance of leadership. You know, you have to be comfortable dealing with complexity. You've got to be comfortable with prioritizing things and identifying risk and mitigating risk. But really, the most important thing in a pandemic is leadership, because people are scared, people are uncertain, people are fearful. And what a leader brings is calm and confidence and a vision of the future. And I got to tell you, I saw that, and I still see that every day in our leaders in Ohio, both at the city level, the county level, and the state level. Really, just leadership. The other thing I learned is the importance of servant leadership, taking care of those you're privileged to lead, because they also are fearful and uncertain, and they've got lives and they've got families. And I see that in our government. Let's take care of those that need our help, and let's be true servant leaders. And I'm gratified to be back to be seeing that now.
Well, I think that's a perfect place to pause and turn to Jonathan and see what questions we may have coming in from the audience. And I know we've opened a lot of avenues for people to ask questions about. Jonathan, do you have a couple questions from the audience for us?
Sure, and I want to encourage everyone, you know, to continue asking questions. But we'll start off with Ali, who says, "Thanks for your leadership, Forrest and CSU. How is CSU planning to vaccinate new international students coming this summer and fall?"
Yeah, that's great. So what I tell people is if someone shows up to get vaccinated, we'll vaccinate you. And so we're planning on that. You know, as I share with you, the state has done an amazing job with making vaccines available, and that's improving every single day. So as our students come back, regardless of the destination they come from, we want to offer them that opportunity. You know, it doesn't matter to me where your home is. You're part of the CSU family, and family takes care of each other. And so we will help find, you know, and get you vaccinated when you come here. So that's a commitment that the president has made, and that we're going to back that up.
Jonathan.
Another comment from Pete Thorpe. "Thank you for your service." So thank you, Pete, for that comment. Our next question, what will happen after the mass vaccination site? Will demand for vaccines be pushed to local pharmacies?
That's a great question. So the state is developing plans on how they're going to continue to increase availability of vaccines going forward. And we've got many community partners, both our health systems, local healthcare provider offices, and not just physicians, but all types of healthcare providers are offering vaccines, and our pharmacies in the community. All of them are rogering up to be able to provide vaccines. So the Mass Vaccination Center is an amazing gift to help focus and get in those folks that are vulnerable, that need to get vaccinated in those what we call socially vulnerable neighborhoods, and others as well, to get in. But when that shuts down, there will be, because the state has been talking about this and planning for this, lots of vaccination centers around. And I think you're seeing the availability of vaccine is increasing every day. So I think there'll be plenty of opportunity for people to get vaccinated after the vaccination center stops services.
Okay. The next question is the mass vaccination distribution at the Wolstein Center proven to be a model for the future?
Absolutely. So this is a collaborative between federal, state, and local government, and us as the host and the support organization. So FEMA is here at the state level, the Ohio Department of Health, the Emergency Management Administration, the governor's office, at the state, at the city level, the mayor's office, the city Department of Health, and the county Department of Health. This is a partnership, as well as our National Guard from Ohio, and actually active military Army soldiers from Fort Campbell, Kentucky have been helping us as well. All of them came together to make this a reality. And so it's been pretty gratifying to see all these people come together to make this happen. And they've done an amazing job. We've been told by the folks at FEMA that this is the benchmark for mass vaccination centers, that the way that this is set up and the way this has been operated is really kind of setting the standard for others. It's from the youngest soldiers in the National Guard, our FEMA partners, our state partners, just showing customer service and how can I help you. It's the efficiency of the operation, where it's an average of 25 minutes that we're being told because of General O'Connor's leadership and focus on customer service. They are just doing amazing work. And the result of that is this is one of the busier mass vaccination centers in the country right now. And how it's being done is helping inform how others should be done.
Okay, and speaking of the model, the next question is, the efforts at the Wolstein Center have been repeatedly commended for their speed and efficiency. What, in your opinion, separates the Wolstein Center from other vaccination sites across the state and country?
I think all the vaccination sites are working hard and really trying to get as many people vaccinated as they can. I was really gratified when this was first planned and we had the initial visit by the folks from the federal government, the state, the National Guard, the Army, the city, and the county come to look at Wolstein. And there was brainstorming session right there on the floor of Wolstein. How might we do this differently to make it easier for people to get vaccinated? How might we make this a pleasurable experience so people will tell their neighbors, and their neighbors in turn will come and get vaccinated? And there was a lot of thought put into that. And then again, our role was, let's support that. What do you need? Our position at CSU was, the answer is yes. Whatever you need, we'll provide, because you're taking care of our neighbors. And you're taking care of the families of our students and our community that we're a part of and have been a part of for over 50 years. The answer is yes. And so I think it was a can-do. Let's put the patient first, the patient at the center of our thinking, and how might we make this an experience that's pleasurable to them so that it can be incorporated into their lives, not intrude on their lives, and they'll tell their friends, who in turn will come get vaccinated. So I think it was a mindset. It was the dedication and commitment, starting at General O'Connor all the way down, to say, let's make this as good as it can be. And it paid off.
Forrest, one thing I'm not sure we talked about is how much longer the Wolstein Center site will be up and running.
Right. So that's an active discussion right now. And so I don't want to get ahead of those folks in their planning. So I'm sure there'll be an announcement.
If there was an end date, I wanted to make sure people were aware of it, but if it's still up in the air, that's good to know.
Yeah, I'm sure they'll let people know. I try real hard not to get ahead of Wolstein.
Why don't we just reiterate here for people to go, and we can probably drop a link to the website in the chat, but for people who want to still try to get appointments at the Wolstein Center, what should they be doing? So
they should go to the state registration website, and it's very easy. It's gettheshot.coronavirus.ohio.gov. So again, that's get the shot, just like it sounds, but it's all one word, .coronavirus.ohio.gov. And when you go there, you'll register and you'll create an account. And you have to create an account to be able to make an appointment. And that's important because when you go to get vaccinated, they're going to enter into your account what vaccine you got and what the lot number was and the expiration date and all of that stuff. So that if way down the road there's ever an issue with that vaccine, they know exactly who got it. And so it's for your safety to be able to do that. And then it'll give you a list of the different sites that you can go to get vaccinated. And you pull, one of those up and you can make an appointment. So it's pretty easy, pretty easy.
Terrific. Thanks for walking folks through that one more time.
And the other thing I'll share with you is if you go to a site that's offering the 2-dose, the Moderna and the Pfizer, when you go get your first shot, they're going to make your appointment before you leave. So you don't have to go back in that site again. You're going to have an appointment when you leave. And that includes Wolstein, which is really, I think, a great thing that the state has done.
And it is important to go back and get the second shot for
Absolutely.
Pfizer, right?
Absolutely.
Right. Somewhat in a different sentiment, Gail, one of our audience members, says that trying to get registered for the vaccine was pretty challenging. So are there any discussions ongoing to create better, more efficient ways to register for the vaccine?
Yeah, absolutely. There have been challenges because of demand predominantly. And again, we get an allotment, we equals the state gets an allotment every week. And that allotment changes based on availability and the needs of both the state and elsewhere in the country, because we're all in this together. And the state has put a lot of effort into that website. The Ohio Department of Health is working continuously to make that website easier to use, more intuitive. And then again, as vaccine becomes more available, to increase the number of appointments that are available. So I tell people, if you have problems, just keep going back, but don't be dissuaded. Get the vaccine. That's a gift that you give yourself and a gift that you give your family.
Okay. John, if I might, Forrest, you touched on this at the very beginning of our conversation, but I wanted to circle back to it one more time. There are folks out there who are skeptical about the vaccine. There are anti-vaxxers out there. Many of us have friends, family that fall in those categories. What advice do you have to folks, what they should say to friends and family that are either they're skeptical or they fall that anti-vaccine crowd?
Yeah, absolutely. So, I think as I share with you, this is not the first epidemic that I've, had the opportunity and privilege to be involved in. But it is different. It is different because of a couple things. Number one, is very highly politicized. And number two, there is a lot of misinformation out there that we just haven't seen in past outbreaks. And it's difficult to navigate and to know who to believe and what to believe. I go by the science, and I look at what is this vaccine? How was it produced? How was it tested? How was the safety evaluated? And again, as I shared at the beginning, I have colleagues that work at CDC and FDA and that were part of this. And I look at it, I said, did you guys cut corners? No, they got rid of bureaucratic inefficiency. They got rid of delay time that was administrative in nature, but the actual activities to prove the efficacy and safety of this vaccine, there were no cut corners on that. And I had great confidence of that, to the extent that, like I say, I got vaccinated and I had my family get vaccinated. And so what I tell people, if you're not sure, go to a credible website, a credible medical website, the CDC, the NIH, the National Library of Medicine, any of the credible professional medical organizations that are out there, and read there, and then make your mind up. There's a lot of misinformation out there about vaccines. but stick to the science. That's what I do. And I find that you'll be better informed so that you can make a more informed decision.
Well, we are we've rapidly gone through our hour. We're coming up on our time, and I want to be very respectful of your time because you clearly have a lot of demands on your time, especially today in launching the new site for students. But I do want to ask one final question, and it's a variation on one that I started asking around a year ago on this webinar. And if you think back to a year ago, it was so hard to see into the future. It was really hard to hope.
Yeah.
And I would ask guests on this webinar, to forward think to a year from now and what they thought we would be experiencing, and to play a little bit of a forecaster. I don't want to ask you about a year from now. I want to ask how you see the next 6 months unfolding in Ohio and in Cleveland, given what you're seeing and experiencing in your role.
Absolutely. So no, thanks, Michael. So there is a future. There is a tomorrow. There is great hope ahead. I tell people, and my favorite quote, one of my favorite quotes, is a quote by Viktor Frankl. Viktor Frankl was a Jewish psychiatrist that was interned in Auschwitz in World War II, and he made an observation that those that tended to survive that horrific experience did so because they had a vision of the future. And there is a future. We will be beyond this. This will be in our rearview mirror. I see the vaccine continuing to become available. I see and hope every day that people will make the choice to get vaccinated as the gift they give themselves and the gift they give their families. I see that people will continue to do the things necessary to protect themselves and protect their neighbors, because we're a Midwestern town. We're a Midwestern community. We care about each other. I see that continuing, and that will set the stage for us to get and put this behind us. There are some things that we need to work through. These variants that we're starting to see. We need to understand those, especially the one that we're now seeing that's coming out of India, that's a double mutant variant. And we need to understand what that does. We need to understand and do the studies that will tell us how long the vaccine lasts. I think we've got some good initial indications on that. We need to be able to do the studies and answer the question of, once you're vaccinated, can you pass it to others? Because that's the whole reason we're still doing distancing and masking after you're vaccinated. That's the whole reason why it's important that if you're asked to test, even though you've been vaccinated, you get tested, because we don't have the answers to those yet. I think in the next year or 6 months to a year, we'll have the answers to those. And I think that, again, hope springs eternal, that we're going to see, as more people get vaccinated, as we get greater clarity on how long that vaccine is good for, how effective that vaccine is against these variants, as we start to get better clarity and understanding on whether or not you can infect others or pass it to others or get reinfected, then I think you're going to start to see, we're going to be able to start to, in a safe, smart, informed way, get back to a normal life. But there is a normal life ahead. I just remember Viktor Frankl, in all creation, only human beings can look to the future. So let's take advantage of that and look to a future that will undoubtedly be brighter than today.
Well, I think those are extremely wise words to end today's session on. I want to thank you for your service to the community, to the country, all that you've done to help keep us in the Cleveland State community safe over the last year, the work you're doing to keep our community safe now through the Wolstein Center. Thank you. Thank you for your time today, when I know there are extraordinary demands on your time. We appreciate you being with us.
Well, Michael, thank you as well. And again, thank you for the opportunity, and especially thank you to the community. The support the community has provided and continues to provide every day just makes me so proud to be a Clevelander, an Ohioan, and a neighbor. And I just want to say thank you to you and to all of the audience today for coming together as a community that cares about each other to help us get back to the future and get back to a future that would be better and brighter than today. So thank you as well for the opportunity.
Well, I want to join you in thanking our audience for tuning in today. I want to thank Jonathan and the entire team at Downtown Cleveland Alliance for the work that goes into making these webinars possible. We are going to take a hiatus in 2 weeks. We'll be back on May 6th for another episode of Downtown Now. Thank you again for joining us today, and we will see you, the audience, again on May 6th. Have a terrific day. Thank you, everybody.
Thanks, everybody.
Bye.